Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are today's reports from the world of medicine. Yoga skill training to improve fatigue in gastrointestinal cancer. Cancer is the most painful and pain-enduring disease. Gastrointestinal cancers are among the most prevalent cancers for both men and women. Over 3 lakh getting diagnosed each year. The prevalence of gastrointestinal cancer is definitely increasing. It is important to address fatigue and co-occurring symptoms during chemotherapy to preserve the quality of life in patients with gastrointestinal cancer. A study in the Journal of Pain and Symptom Management reported yoga skills training intervention compared to an attention control among adults who have been diagnosed with this particular cancer. They showed promising improvements in fatigue, depressive symptoms, sleep disturbances, and inflammation. The yoga skills training is also considered feasible and reaches patients underrepresented in yoga research. Effects of copper interuterine devices in pregnancy. An intrauterine device is one of the most effective reversible contraceptive methods currently available. Intrauterine device, that is IUDs, as the most preferred contraceptive measure worldwide. About 23% of women who use contraceptives choose intrauterine devices. A recent study measured the changes in the human leukocyte antigen and the insulin-like growth factor levels in the decidua and villi to explore the effect of a copper intrauterine device on the embryonic development. And it was published in Growth Hormone and IGF Research, where it concluded that the copper intrauterine devices may reduce the insulin-like growth factor expressions in villi tissues, which could compromise on the embryonic development. Thus, an intrauterine device during pregnancy may definitely be risky. Smoking to affect fetal lung development during pregnancy. Maternal smoking is dangerous as developing fetus is at an increased risk of multiple adverse outcomes, including prematurity and even low birth weight. Children of smoking mothers present more frequently with respiratory pathology such as respiratory infections and wheeze and are more likely to develop even asthma. Nicotine replacement therapy and e-cigarettes are recommended to pregnant women who wish to stop smoking. According to a study in the Early Human Development journal, nicotine can impair the fetal lung development, leading to concerns regarding the safety of nicotine replacement therapy and e-cigarettes in pregnancy. The studies, however, are yet to explore the impact of these nicotine-containing products on the infant respiratory outcomes. Cashew nut shell liquid to help curing oral infections. Oral diseases affect half of the world's population, with dental caries being the most prevalent condition evaluated and considered a major public health problem with high medical costs as well. The study evaluated the antibacterial and the antibiofilm activity of natural and technical cashew nut shell liquid against streptococci and enterococci related dental caries and chronic apical periodontitis. The findings that have been published in the Archives of Oral Biology states both substances showed effective antibacterial and antibiofilm activity against the strains used in the study, except in viability of parasanguis cells treated with technical cashew nut shell liquid. Cryotherapy after exercise, a better treatment for muscle stiffness. High-intensity exercises, especially those with eccentric contractions, cause muscle damage and it can lead to injuries such as decreased muscle strength and decline in range of motion. Now, since these muscle injuries affect a sport's performance, it is important to repair the damage after exercise. The Journal of Exercise Science and Fitness reports a study that investigated the effects of liquid ice on the change of passive stiffness as muscle function and to validate the effectiveness of liquid ice compared to a block of ice. The rate of change between pre- and 48 hours in the liquid ice was significantly lower compared to that of block ice, and these results can definitely be considered helpful for the choice of intervention for reducing muscle stiffness after exercise and at sports field. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.